Imagine, if you will, that your family has a surefire hangover remedy. It's never been scientifically tested or verified, but every time you drink alcohol, you never suffer hangover symptoms. The recipe has been handed down for generations, and no one in the family is quite sure when it was first made, let alone who concocted it. Still, the family carefully mixes the secret ingredients, and you never have to worry about a hangover again. Now, your family, being the stellar folks that they are, have offered this remedy to the healthcare system many times before. Instead of gratitude, your family has experienced ridicule and discrimination because of this hangover remedy. To make matters worse, greedy and conniving individuals have tried to steal the secret recipe and have even killed some of your family members in their attempts to do so. Would you be willing to disclose your use of this hangover remedy to your doctor? Most of us would answer no. We have no reason to trust a member of an establishment which has tried its hardest to discredit us. But this is how Native Americans feel about traditional medicinals. They have suffered at the hands of the medical profession for centuries and are thus reluctant to disclose their use of traditional medicinals to anyone outside their communities. Yet, unbeknownst to Native American patients, some of the traditional medicinals that they use can interfere or cause severe harm when used with biomedical drugs. Hellebore, an herb used for pain and sedation, dangerously lowers the heart rate. Beta blockers used for heart disease have the same effect. When used in conjunction, these substances can actually induce cardiac arrest. Diuretics, medications which increase urination, are used for heart failure patients. Goldenrod, a traditional medicinal used for menstruation and urinary problems, has the same effect, and concurrent use can cause kidney injury or failure. Black cohosh is utilized for menstruation problems, menopause symptoms, and asthma, but it strongly inhibits one of the major liver enzymes responsible for metabolizing most antibiotics and heart medications, rendering them useless in the body. Concurrent use of traditional medicinals and biomedical drugs poses a significant risk of patient harm, which is largely unrecognized by healthcare providers, traditional healers, and Native American patients. So, what can be done? One of the biggest challenges faced in the elimination of this problem is the lack of education. My project developed educational materials for healthcare providers to understand what traditional medicinals are and the potential risk for prescribing biomedical drugs to Native American patients using them. While an introductory effort, the policy recommendation to incorporate traditional medicinal education into continuing education programs for healthcare providers is an instrumental first step to reversing the burden of health disparities experienced by Native American peoples. My policy recommendation and educational materials address discrimination and distrust between Native American patients and their healthcare providers by as well as minimizing the risk of patient harm through awareness of potential adverse interactions. Lastly, efforts to integrate Native healing methods, including traditional medicinals, through better healthcare provider education and access to resource materials will greatly enhance the quality of life for Native American patients. Respecting and incorporating traditional medicinals honors the holistic care for Native American patients, supports their autonomy, and promotes the mainstream adoption of traditional medicinal alternatives.